Homeless population. Homelessness has become a major public health issue in our community within these last few years. There are many homeless individuals on the streets of all major communities and cities in California. With this recent surge of homelessness in California, come with many health issues among homeless individuals, such as substance abuse, high risk of HIV infection, risk of violence and abuse, physically assaulted, risk of being robbed, attempting suicide, alcohol abuse. Background. According to the Chelsea and Addison, homeless individuals are likely to suffer from chronic diseases and are vulnerable to violence. The percentage of homeless individuals using hard drugs other than marijuana, for example, meth, crack, cocaine, LSD, heroin, and ecstasy, differ across drug groups and ranges from 23.7% to 73.4%. In addition, also, living on the street leads to an increased risk of violence and abuse. About 51.6% of homeless individuals reported being physically assaulted, 24.5% said being robbed, and 20.8% testified being sexually assaulted, and 28% experienced multiple types of street victimization related to substance abuse. Analysis and resources. Furthermore, drug use among homeless people has been recognized as a predator of unprotected sex and other sexual risk activity. This behavior could predispose these individuals to a lot of health issues such as HIV, Hep C, and other forms of STD. So with this being said, during hospital visits, healthcare workers, healthcare providers, and nurses should use this opportunity to provide homeless individuals with resources that are available to them, such as mental health services, refer them to social worker for assistance, also make a referral for behavioral health. Because sometimes this is the only opportunity they have to get some information. It was also noted that the rising case of homelessness in our city is due to the increased cost of housing in California. Most people could not afford housing anymore due to the high rent and inflation. The plan. It is now long overdue for both state and federal government to address the issue of homelessness before it gets out of hand. Though government officials have made effort to control the growing problem, but more needs to be done by state government and the nation at large. The government needs to create a program that will minimize homelessness with individuals facing unstable housing. Government needs to create more jobs, housing, and more rehabilitation centers to help reduce substance abuse and to monitor substance use among homeless individuals. They need to also make housing price more affordable in our community. Also, government also need to create a program that will help screen homeless individuals at least monthly to facilitate early diagnosis and treatment of any diseases or any problem that is facing the homeless individual. Also, last week on the news, Governor Newsom addressed the issue of homelessness in our state. He said it is time for California to do something. It is time to address the issue of homelessness. He said he budgeted that this California state are gonna build some places for homeless to accommodate the homeless, just to get them off the street. Also, it was also in the news yesterday, the Bakersfield local news. Also, they also did mention the issue of homelessness in our community. According to the news, so it was stated that the homeless shelter has added about 48 beds to help get single women off the street. I think it's like both the state and the city council have recognized the issue of homelessness as a public health issue, and they are working towards in addressing the issue. I think with that being said, yeah, they are working towards making a change so that to address the issue of homelessness in our community. This is my reference.
Especially right now.